Welcome to the Heart of It All. I'm Teri Hart. Today we are talking all things doctor's visit. If you're lucky enough to have a family doctor, then knowing how to maximize your visits with the seniors in your life is a priority. We will find out what you can and cannot do, privacy concerns, what your doctor needs from you, and so much more. Everything you need to know for a GP visit this week on the Heart of It All. On the Heart of It All, we talk about healthcare a lot, often with specialists and when we have identified a problem. Today, we're talking with a family doctor about how you can prepare for those crucial appointments and what you can expect as a caregiver. This episode of The Heart of It All is brought to you by Capital Direct. Since 2006, Capital Direct One Income Trust has been investing in and supporting Canadian families and homeowners. The Capital Direct One Income Trust may be a perfect addition to your portfolio. Their proven track record has been recognized by the Canadian Hedge Fund Awards for Best 10-Year Return and is eligible for qualified investment accounts, including TFSA, RESP, and RRSP. Visit incometrust1.com to learn more. Our family doctor is ground zero for our health. And when you're in a caregiving role, knowing who that doctor is and them knowing you can make a huge difference. Dr. Nadine Laraya practices comprehensive family medicine in Toronto. Her patients currently range from ages 0 to 99 years old. She is a fellow of the Canadian College of Family Physicians, is a lecturer at the University of Toronto, Temerity Faculty of Medicine, and holds primary care leadership roles at St. Joseph's Health Centre and at the West Toronto, Ontario Health Team. She is the mom of 2 teenage daughters and a caregiver for both her parents. Dr. Laraya, thanks for being here on the Heart of It All.
Thanks so much for having me.
So, first of all, thank you so much for practicing family medicine, number one. And tell me a little bit about your practice and how it fits in with family medicine across the province, because it's a really important factor.
For sure. So I work as a family doctor in an urban area. I work in Toronto. I work in comprehensive care in a group setting. And I think it's important to know family medicine looks different across regions and across practices and across practitioners. There are so many different models of care that all have, kind of different ways of running their day, running their appointments, different policies. And of course, that's without even going into the fact that different doctors have their own styles and personalities. So my practice is something I've been part of for over a decade. I think 13 years now. So I've had the opportunity to get to know most of my patients over that time. I take care of the full spectrum. So I have babies who were born last week all the way up to, I think my oldest patient is 99 years old and thriving. And things are always evolving. I think one of the most interesting things about family medicine is that as you grow with your practice, your interests and your priorities and your expertise also starts to adapt. So you kind of grow alongside your patients, and as the knowledge changes, your approach changes. So it's very, very dynamic. And I have to say, I love it. It's equal part, challenge and frustration, but there's also so much joy, especially when you have the opportunity to get to know a family, sometimes up to 4 generations at a time. And you can really watch how everyone kind of interacts and how everyone's navigating through really complex world.
So one of the reasons, or I guess the reason to have you here on this is to talk about the relationship of doctor, patient, caregiver, and how that kind of triumvirate, that triangle of trust or sometimes mistrust can work, and what we can learn about the GP relationship and that dynamic. So And I want to be clear, you're speaking from your experience and how you practice medicine. This will be different depending on who the general practitioner is, who the family doctor is, and of course, if people are even lucky enough to have a family doctor. I think we have to recognize that problem as well. So, what is your policy if a patient wants to bring a caregiver, whether it be a family member or a friend, to an appointment?
Absolutely. The default is it's a given. For some, patients, it's a requirement. It's a given. For example, you would never have a 2-year-old show up by themselves. Of course, they're going to have a caregiver. And similarly, someone who might need a little bit of assistance will probably always come with a caregiver as well. We might see patients transition between having very independent visits at one, stage of their life to starting to need a caregiver attend appointments with them if there are cognitive issues or mobility issues where they need an extra support person. Basically, my policy is that if the patient needs it or wants it, the caregiver is absolutely welcome.
So, does that always mean that the caregiver is in the room with you and patient, or is it caregiver comes, drops off patient, then maybe comes in at the end to get a recap? I mean, how is it handled, and is there one way?
Depends on the situation. And that can be negotiated before the visit. It could be negotiated during the visit. A lot of family medicine it's a bit like improv where you have to, kind of get a sense of the situation and be ready to pivot at any point. So we don't make any definite plans. We are ready for the unexpected. So if, for example, we have someone who has been dropped off by a caregiver and they come into the office and I'm having an interaction with them and I'm having a little bit of trouble. Maybe it's having difficulty understanding, or maybe I'm noticing something where maybe I just need a second opinion on how things have been going over the last little while. I might ask the patient first, can I ask your caregiver to come in and join us? And if that's a go, because it's always the patient's choice. So I would make sure it's okay with the patient, and then I would go out and ask the caregiver if they might wanna step in for a few minutes and just help out, and then take the encounter from there. There might also be the situation where the caregiver comes in and is maybe providing too much information. Maybe there's a little bit, of a distraction happening. Maybe it's something is happening with the natural flow of the conversation. I'm not able to really communicate with the patient the way I would like to. And my gut feeling is that something is off and I need to really have a bit of time with the patient. So in that point, I might ask the caregiver to just, wait in the waiting room for a few minutes. I'm just going to have a little bit of one-on-one time and then maybe invite them back and then kind of synthesize how the entire encounter goes after that.
What do you think is important for family members or caregivers to know when they are going to a family doctor appointment?
So let's take the situation where a caregiver is attending a family doctor appointment of the patient, but they've never met the family doctor before. I think one of the most important things is let the doctor know as soon as possible that the caregiver is going to be there, because that will immediately allow the doctor to kind of think of some ways in which, we might need to be ready for questions. We might need to be, set a proper room up. Some of our rooms are smaller than others, and it would be great to be able to bring them into a room where there is enough seating or room for a wheelchair. Like there's so many logistical things that we can optimize if we know what to expect.
I love this. Does that give an opportunity to book a double appointment?
Yeah, I mean, I think we can always adapt the appointments to suit what needs to be done. And that I think is the most important thing, that when you call, and this is a principle across, I think, all of family medicine, is that when you call to make an appointment or book it online in some cases, The more information you can provide to our office assistants, the better we can accommodate. We have the liberty of booking a double, even a triple appointment. A lot of people I find are very hesitant to tell office assistants why they're coming in. I'll say that my least favorite types of visits are the surprise visits where the office assistant puts down would not say. So it's like, okay, it's a black box today. I don't know what I'm going to deal with, but it might be interesting and it might take 10 minutes or it might take an hour. Who knows? So
Do you think some of that hesitancy, because I think I've had this hesitancy, do you think some of that hesitancy comes from privacy issues of talking to the office assistant versus talking to the doctor? How can we clear that up?
it's important for people to know that our office assistants are subject to the same confidentiality principles that we are. And they're there to help, and that entails making sure that when we book a visit, it's at the right time of day for someone. We have the right support personnel available. We have the right rooms available. That's what we're really hoping to do. So it's really in our patient's interest to give us as much information as you can. Now, if some stuff is private, that's okay. You can say, this is a private thing, prefer not to really talk about it, with anyone other than my doctor. But suffice to say, I have a bunch of questions and, it might take a little bit of time. We can read between, our office assistants can read between the lines and can help get the right appointment set up. But when things are set up from the beginning, then that just allows the actual visit to go so much more smoothly.
We're going to end up talking quite a bit about technology in this interview because I think technology is creeping in, maybe not creeping in, maybe flooding into our medical system in a way that is very, very positive and can also create some challenges. So, what are the legalities about recording an appointment with a doctor, whether you are the patient? So if I'm sending my mom and I can't be there and I'm like, record the appointment on your phone, mom. Can she do that? Or can I record the appointment if I'm there as her caregiver?
Okay, great question. And very topical. It happens a lot. And as per usual, the answer depends. It depends on the situation. It depends on the reasons. If someone is in the room and takes out their phone and says, I would like to record this, legally, they can do that. I can't say, oh no, you can't record this. However, depending on the relationship, the reason for the recording, we might have a policy around recording. We may need to have a conversation about that. And at the end of the day, if a patient or caregiver wants to record and I don't want to be recorded for a number of reasons, I can't tell them to stop recording, but I can postpone or terminate the visit. So ideally, we don't get to that because I think there's a lot of room for discussion.
Can I ask why you would not want to be recorded?
Yeah, I mean, first of all, no one loves being recorded without knowing ahead of time. So sometimes it can be jarring. We're human too, and no one loves the idea that suddenly everything they're saying is being recorded on someone else's device. You don't know how that's going to be used. You don't know if it's going to be posted. You don't know if it's going to be taken out of context. You don't know if it's going to be misinterpreted somehow. Like, it's just that we never know if something is going to be used for something that's outside of our control. And that's a very uncomfortable feeling to have. And for that reason, to keep it simple, many offices, just have a blanket, no cell phone, no recording policy, just to keep it very, very simple. Now, that's not to say there aren't instances where recording can be really helpful. So, for example, there's a lot of information that we're conveying at the end of the visit, and a lot of people have moved away from taking notes on pen and paper to recording and screenshots and that kind of thing. So, we might say, okay, when I get to the point where I'm talking about what our plan is going to be and what the sequence of events are going to be from here on in. It's going to be a lot to remember. So maybe that's the time to turn on your phone, and we can agree that that's acceptable for you to record if that's the best way to get the information across. But there are other ways too. I mean, if it's about information retention, I can also write it up for them. I can give them a copy of my clinical note. I can give them a pre-printed handout. There's lots of different ways if the goal is for information retention.
I gotta say, I was surprised by that answer. I really, really didn't think of the intricacies of what that recording could possibly mean for a doctor, the vulnerabilities for the doctor with that scenario. And if it is about information retention, there are different ways to accomplish the same thing. I think that from a patient perspective, one of the things that, and a caregiver's perspective, if I couldn't be there, I would want to say, I wanna hear what the doctor's saying the way you did, so I can understand it the same way.
Mhm.
How would you respond to that as a "let me record"?
Right. Yeah. So let's take the situation where the patient might be in the room with me. The caregiver can't make it, or maybe they live in another city for whatever reason. Um, and they want to patch in. So the patient says, "Oh, my daughter can't be here today, but she would like to join by FaceTime. Is that okay? Or by phone?" So I think that's fine. I think if the FaceTime is being recorded, I would like to know about that. I think that's just it's kind of a common courtesy, because you can be on the phone and just jotting down notes. Um, Once you're recording a FaceTime, it's essentially the same thing as being in the visit, because, if it's a video, then, my image could be captured. I could be taken out of context. Like all kinds of those of things can happen there. But I think technology has led us to a point where it is possible for the right people to be in the room, either virtually, by video, audio, in order to get that same information in the same language. So I think we should use those technologies, but be very cautious about and transparent about recording. I mean, do people record without me knowing? Yeah, I'm sure that happens all the time. Um, it's disconcerting.
So let's talk preparation. What should people have at the ready to maximize the time for their doctor's visit?
Great question. So let's say, take that scenario where you have a patient who has maybe escalating needs, and this is the first time that a caregiver is joining in the appointment. So the first thing as a caregiver and patient dyad together is to know what is the purpose of the visit and how long do you have. So if you're unless you're told otherwise, assume 15 minutes, because that's our sort of standard sort of division of time. But I think the most important thing is know why you're going. Are you going to do a full medication review? Are you going to ask a couple of questions about a recent specialist visit? Are you going to have a discussion about advanced directives, or about maybe a transition of care to something like palliative care? Like, what is the nature? Like, what is the one key goal of the discussion that you want to accomplish that day? And then maybe prepare some questions, or some points that you want to some points of discussion around that. So that's probably the most important thing, is know why you're going to be there. So the second thing I would say would be really helpful is to have all the medications with you, and have them in bottles. You know,
Oh, actually physically bring
yeah.
them.
I mean, not every time. I mean, maybe the first time, or at key visits, or if you're going to do a medication review, then bring all the medications to that. The reasons why I say bottles is because I can get a lot more insight about how medications are being taken when I see the bottle. So if someone tells me, "Oh, I'm taking this medication every single day," and I look at the bottle and the date says 2024 and it's still full, that tells me a little bit more information about whether this medication is actually being taken every day. Or if it looks like they're managing like 20 bottles and they can't sort of figure out what's what. I'm thinking, oh my God, I can't even figure out how to make heads or tails of all of this. I think you might need a blister pack. Maybe we need to organize this a little bit better.
Okay, so that is crucial information. I had people have heard me say I had a Google Doc that I shared with the whole family about all of my dad's medications, and it maximized the time,
Yeah.
which I
Yeah.
think is a goal.
Absolutely. And sometimes that can help too. So keep in mind that most electronic medical records have a record of the medications. And the sort of strategic reason we like to have um, the family either bring in a list or bring in the medications is so we can compare them. You know, this is the list that I have on your chart. Is it the same as what you're actually taking and bringing with you? Because there may be mismatches. There's literally opportunities for medication review visits where we can sit down and say, okay, let's just clean up your list, see what you're taking, reconcile this all together, and make sure that everything's on the same page. And that's a great visit.
That is an amazing opportunity for people not only to do that medication review with a doctor if they've had a sequence of events that they've introduced new medications or some illnesses or something new added, but also an opportunity to have the conversation with the loved one, with the caregiver, whatever way they're talking about all of these things and where their health is at. It's like it would be like a line in the sand. Now we're working from this new normal.
Yeah, absolutely. Absolutely. It can be really helpful. And another opportunity we have at these medication review sessions is the opportunity to do what we call deprescribing. So there are sometimes medications that people might be taking that they just don't need anymore. It's a big burden. Like you think a pill is nothing, but it takes up physical space in your stomach, and it's an additional task in the day to remember to take it. There does reach a point in any health journey where less is more. So, it's an opportunity to look at a medication and think, is this still needed? Is this still doing the job it was supposed to do? Have the side effects or adverse effects maybe started to outweigh the benefits? So, it's an opportunity to look at each of the medications through that lens and, kind of help make a decision. It's wonderful to be able to have someone come in on 20 medications and leave on 12.
I have a question about what is the responsibility from your family doctor with your medications and your pharmacist?
The best working relationship is when we are we're leaning on each other for expertise. So pharmacists are extremely knowledgeable. I'd say in terms of how to take medications, the actions of medications, the side effects, et cetera, they're the experts. They can really help figure out when and how and take this at night, take this in the morning, take this with food, take this without, take these two together, but don't take these two together. They're often the ones making the suggestions for things like blister packs, to help because they're also seeing how often people come back. They're the ones seeing that, if people are running out early, if people are forgetting to fill their medications and there's gaps in care, like they're also noticing those sorts of things. So working together with a pharmacy team is a really powerful way to make sure you've got multiple eyes on your medication regimen.
That brings me to my next question, which is I'm going to present a scenario to you. So let's say a family caregiver goes to a doctor's visit, they're in the room and they feel that their loved one, the person that they're caring for, is not exactly representing the situation accurately. What do they do?
There are many perspectives on how things are playing out at home. Basically, the way things would go when there is a caregiver and a patient is that, you know, we really try to keep the focus on the patient. So, you know, I'm still talking to the patient, and the caregiver is really the third person in the room. So maybe I'm hearing exactly the same story as I've been hearing for months and months and months. And this is how the patient is responding to them. And in the corner of my eye, I might see the caregiver going, "Nope, not the way it's
Or
happening."
more aggressive than
Yeah, right, and I've been that person too. I've been that caregiver as well, watching a parent give a story and, in my mind going, "Oh my goodness, no, 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 no." The primary goal when you're in a situation like this as a doctor is to understand. You have to understand, like, read the room. Someone is telling you something and someone else is responding non-verbally in a very, very different way. Okay, there's a disconnect here. So how are we going to manage this? It's still the patient's show, it's still their visit, but how are we going um, to get the caregiver to the space to say what's on their mind. So that's where it becomes a bit of an art in facilitation, where I might say something like, "Okay, thank you for sharing that with me. I'm noticing your daughter is, she looks like she wants to say something. Is it okay if I ask her a couple of questions?" But at the end of the day, my take home is that there's two versions of the story going on. And so, you know, uh, and that's information. That's information that helps me make, a diagnosis. It helps me think about the next steps for a plan. It helps me maybe think, okay, is this an inflection point? How long has this been going on for? Does this change everything I understand about the patient? So there's lots going on there that, and you can imagine it's incredibly helpful to have that extra voice in the room, because that at the end of the day, if I can understand a more realistic version of what's happening, then I can make suggestions that are going to be more useful and more helpful for this family. If I get a version of the truth that, someone's telling me that everything's fine and there's no problems at all and they're cooking every day, and the caregiver's shaking their head, I'm thinking, okay, something needs to happen here so this family can get the support that they need.
okay. So next scenario. What if you feel as a caregiver that the person who you're caring for is not being honest with you about what their doctor has told them? Can you call up somebody's GP and say, you know, I am the daughter of whoever, and they just had an appointment and she told me everything went fine, but I don't believe her. What happened? Can you do that?
Yeah, that's a great question. So this is a question really about consent and privacy of information. So it really depends on what has been established with the patient. So if the patient has said in the past or provided in writing that the care team is permitted to share information with these individuals, and they should be named, then, that constitutes as consent to share the information.
Is that a verbal consent?
It can be verbal, it can be written. Verbal, in my practice, verbal works fine.
So I'm going to make it personal because I make everything personal in this podcast. Should I be saying to my mom, hey, mom, if I call up your family doctor, can you give them permission to tell me your medical situation? Should I be having that conversation?
Yeah, absolutely. I mean, I think that's a great thing to bring up when you maybe meet the family doctor for the first time. Yeah, it's helpful for us if we can kind of put a face to the person, and it's great if we can have that exchange, when it's appropriate, and when the patient has to be capable of making a decision, and that's a whole other sort of area to for another story. Um, if you can say, is it okay if I share information directly with your daughter and I get consent right then and there and I know who the daughter is? That way, when the daughter calls me, I kind of know that she's part of the care team. I know who I'm talking to, and I know that I've at least had verbal consent from the patient to share information. Now, if I don't have that, and let's say, I have my interaction with a patient, and then a caregiver that I have no idea about. I've never met this person. They're calling me out of the blue and they're telling me that they're a son who lives out of town, and they're asking for information about their parent. I mean, at that point, I can't really I can't share anything from the chart. That's confidentiality. What I can do is accept information if they want to tell me something, if they want to add something to the chart, if they want to provide extra information that maybe I don't have, but I'm not at liberty to tell them anything. I can't even tell them really that I'm their their parent's doctor or when their parent might have come to visit me. Like, I can't disclose any of that information legally.
What would be a next step if they're like, okay, I understand that you can't give me this information, but I really need this information because I can imagine that being a very stressful. Like, I don't think mom is being honest with me. You're my only hope here. Would you say, why don't you come with your mom to the next visit? Is that the answer?
It could be. Yeah, I mean, that's an issue that depends on logistics. So, if that person can come, that's ideal. So I can meet them and I can, ascertain with the patient in the room that this is a person that they feel comfortable me sharing information with. Um, and, you know, another option is, if the patient is someone who is able to communicate well, it's cognitively able to manage a phone call. I could have a conversation on the phone with them, and they could give me the name and number, and I could call them back. There's a lot of ways of working around this, but the most important thing is that we can't give patient information to somebody who we don't know who they are, and the patient hasn't given us explicit consent to share information with them.
And that's the world we want to live in. It can be complicated to keep track of everything. What's your advice in terms of keeping track of stuff? Is there a tool? Is there an app? Is there a book?
Yeah, probably. There are lots of different, very specific things, but at the end of the day, it has to be an organizational system that works for you. It can be a book. I mean, if you're a pen and paper type of person, a dedicated, kind of planner or desk calendar or something that has everything in it is one option. If you're more of an app or online calendar kind of person, you can dedicate part of an online calendar to visits. You can use shared Google Docs. You can use a paper filing system. I think the important thing is that you have some kind of organizational system so you can have everything in one accessible place that you're consistently going back to and checking in on. So you can have the most sophisticated app that tracks every little thing. If you never open it, it's not very helpful. So I think the most important thing as a busy caregiver is that it's really important to know that this aspect of caregiving takes a lot of time. And it's important to give the appropriate amount of time that it takes to do this organizational work, to do the planning so it fits in. Like, for example, I have to take my parents to various medical visits, social things, and I need to fit it into the context of being a professional and having my own family as well. So I need to really spend time with my calendar and figure out where things are going to fit in. I really have to advocate for appointments being at times when I'm available, that sort of thing. So, it is a task. It's not unlike being a professional executive assistant where, you have to approach it the same way that you would approach any other professional endeavor. But caregiving, the logistics of caregiving and organizing, especially if there's complex medical appointments and a complex schedule and a complex medication regimen, it takes time and energy and resources to manage.
When you start in this environment, it is absolutely shocking how many things need to be taken care of, or I certainly felt overwhelmed and shocked by it. Caregiver, caregiving, doctor, it can be a bit of a three-person dance. And I don't know if you've done many three-person dances, but that's not how dancing's supposed to happen. It's supposed to be two people. So it can be pretty awkward sometimes. Nobody who knows me will find this a surprise. You probably won't find it a surprise because you part of your job is to be a detective, I think, as you've expressed today. But maybe sometimes when I was in an active caregiving role with my dad, maybe sometimes I could overstep. Maybe sometimes I could go in like a bull in a china shop. And I'm wondering, can a caregiver be overprepared or too involved or overstep?
Yeah, that's a really, it's a great question. It opens up a very, um, kind of almost existential conversation about the nature of how we behave under stress and, how we express our love for people and our concern for people. So, first of all, I love dancing. It's one of my hobbies. It keeps me going. And I can dance with one person, three people, a group of people. I'm not always great at it. I miss steps sometimes, but I love the dance analogy. I would say that if I am witnessing something like this, because the doctor's office is like really just a micro representation of what actually happens in somebody's everyday life. So, for me, when I kind of, change my perspective on it, I sometimes just get a window on what the dynamics might be looking like at home, and if what can I observe about what's happening here that gives me a clue as to how things might be playing out for everyone. So if I'm seeing with my own eyes in an encounter that there is, a challenging dynamic happening, the best way that I can approach it, again, family medicine's like improv, so you kind of have to sit back, listen, pay attention. So if I'm noticing an interaction where, let's say, a caregiver is maybe say over prepared, is, asking a lot of questions, getting into the weeds about the latest study that just came out of Harvard, and what's my opinion about this obscure medication that just came out in Europe, and and I'm thinking, oh wow, this looks like someone who might be experiencing some stress, and so maybe there's something happening here that, like. I may not address it at that visit, but maybe it's something that I just keep in the back of my mind and think, there might be something to explore here. And, we try to stay on task, but, I might know that this is something to pick up on at another time. Now, there are also other dynamics that are, really, really important to look out for, especially when you're in a situation with someone who might be elderly and unable to really advocate for themselves or communicate as well as they once have, and you have a caregiver who starts to display certain behaviors. We have to really watch out for things like elder abuse. That's a reality. There is a lot of, frustrations in some, often it's a parent-child relationship, but it could be a different relationship too, where there could be anger, there could be stress to the point that there's harm happening, or there may be some kind of secondary gain. Like the possibilities are endless, but at the end of the day, you have to watch out that there, is the dynamic of this relationship just showing a normal amount of stress, like that's consistent with the fact that this is a really challenging situation and everyone's responding in an appropriate way because it's taking a lot of energy and it's taking a lot of time and everyone's capabilities are changing in real time, that in a way that people aren't really prepared for. Or is this something that's a little bit more um more concerning, more deliberate? Is there some kind of dynamic here that's really worrisome?
Is there a specific question or kind of pillar of a question that caregivers should be asking the person's family doctor? Is there one thing that it's like every caregiver should make sure they have the answer to for the person they're caring for?
Yeah, I think the broadest sort of question you should have clarity on is, what's the goal? And that's going to be individual. Everyone has different goals in their life, but what is the goal here? Is the goal to be comfortable? Is the goal to pursue every medical intervention in the book? Is the goal to travel the world in the next 2 years? And you set up what your goal is. And that's kind of the main, sort of endpoint to keep your eyes on. But I guess a more practical question is, when you're in with a family doctor, kind of recognizing like how can we best utilize this relationship? You may have many people involved in the care of a loved one, and the family doctor may be quite peripheral to that, and may just be someone who kind of guides you, maybe helps interpret some of the specialist reports, helps organize a couple of, maybe some home care options, or they can be the person who is managing literally everything, going into the home themselves, arranging for all of the infrastructure to be brought into the home, the oxygen, the hospital beds, and all those things. There are communities where the family doctor is the team and they do all of those things. And then there's other places where, I think it's important for the family to know what can the family doctor help with? Are they the person to call for the home care issues, for the blood work, for if there's questions about, maybe a complicated medication regimen that's initiated by a specialist? I think it's important to know where that family doctor is situated and what role they play because it's going to be different every time.
So ask those questions. Are you the person I ask for X? Are you the doctor who's going to do Y? You said, Dr. Laraya, that you are a doctor, of course. You're also a mom to teenage daughters, and you are a caregiver yourself. And you told me on the phone before this interview that with your medical training, becoming a mom, nothing had prepared you for becoming a caregiver for your parents. Why and how?
Yeah, caregiving's kicking my butt and in in the most meaningful way, and I wouldn't live my life out any other way. So, I was quite early in my medical career when I had my 2 daughters, so I've always been a caregiver as long as I've been a professional, not in school. I've always had, half of me kind of attending to my family. That's just been the nature of my approach to work. So I always kind of kept that personal division, and I've always been, a really big part of my kids and my family's life. And actually with the help of my parents, my family, they were actually part of what allowed me to do as much as I have in my career and also be as present as I have been able to be with both my kids. And I'm so proud of them. They're both in high school and doing really well. And I couldn't be happier with them. Them becoming a little bit more independent coincided with my parents needing me a little bit more. When I think about the type of support that I had when my kids were growing up, mostly from my parents, and how now I compare the needs that they have with what my kids required of me when they were younger, and it's just so much different. Um there's probably just as many like logistical responsibilities, whether it's appointments, managing shopping trips, all that sort of stuff. I'm connected. I'm the only child who lives in town, and I'm fortunate to live just a 5-minute drive away. But at the end of the day, there's always something to do, and I think the hardest part is, it's witnessing that change. I mean, when you're watching children grow, you're watching a very different sort of evolution happening. And with aging, it's a little different. Now, it has its moments as well. There's a lot of joy in knowing that, my parents are both in their 80s and in a lot of ways still, great to hang out with and have there's a lot of joy in our interactions. There's frustrations too, and I can tell they're frustrated with things, and there's interactions that I find frustrating, and it takes a lot of time. And when you witness decline, it's very emotionally tough because these are people who 10 years ago were helping me do my do my work, and now they need my help in order to live their lives. And it's very difficult to approach that in a way that does them justice, right? Because like these people, they're really everything in my life. They've set the stage for everything I am, and and by extension, who my kids are. And now they need me more than ever. And it's emotionally really, really tough sometimes to be able to meet that.
Like I say, yes, we're all living longer, and that's fantastic, but it's not without consequence.
Yeah. Yeah, and living longer in isolated situations is very, very different than living longer in like a more multi-generational household where there's people around and, a single meal that gets prepared at the end of the day. So both of my parents were not born in Canada, and their perception of like what it was like to grow older is very, very different from the reality that they're facing. And it's very, very hard to meet that expectation. You know, but we live in North America, and our lives are what they are. So, unfortunately we don't have we don't have the multi-generational households that they grew up in, and so we have to do things a little bit differently. So a big part of my understanding of medicine and life is knowing that aging happens, and this is what it looks like, and this is what's important, and these are the conversations that need to happen.
And helping people live their best lives as they age. We can do this.
And not imposing on them what we think is their best life. I think that's an important distinction too.
How has the experience with your parents as you've become a caregiver to seniors or more active caregiving in your life to seniors, how has it changed you as a family doctor?
So it doesn't take a lot for someone, they just have to say one thing about, you know, "Oh, uh, I have to take my mom to an appointment today." For me to just connect with that and say, "Oh, I know what that's like." You automatically can go to that same place as a person when you've had that similar experience. I think that's just how we are as human beings, is that when we have common ground, we just connect. But this is a way in which I cultivate my relationships with people, is by finding areas of common ground. And the experience of being a caregiver allows me to find that common ground. And then it opens the door, because that person may come back to me a week later and say, "Hey, I know you get this kind of stuff. So a caregiver, I'm kind of getting crushed by this. What do you do?" And so we can have that conversation, because caregivers are, another really important, sometimes invisible group of people that suffer a lot of their own challenges and stresses, and don't always have time or give themselves permission to take care of themselves.
Yeah.
Like, one thing I've recognized as a doctor taking care of people who need caregiving, is at a certain point, very little of it is actually medicine. It's managing, like, it's healthcare and human care, but very little of it beyond diagnostic and maybe some therapeutics. I mean, medications for many conditions can be limited, especially if you're dealing with cognitive stuff. It's not At a certain point, it's not a medical thing. It's a caring for another human being sort of thing. And so there are other people other than, like, outside of medicine to lean on. And so there is a lot of knowledge that is spread out amongst so many amazing people, groups, professionals, societies. I mean, I lean into the Alzheimer's Society. They are the ones who I go to when I need support. So I step out of my job of being a doctor. Being a doctor helps me understand a little bit what's going on, but it's not the whole story. Like, the whole caregiving part, I'm just like any other person who's taking care of their family.
I end every episode with the same question. And based on what you just said, I think that um, I thought I was asking you this as a doctor, but I think I'm asking you it as a caregiver. What can we better do to support caregivers in our society now?
Oh, such a great question. The most important question. I think overall, it makes them more visible. Caregiving, I think everyone is going to have to do this at some point for someone. Maybe it's not your own parents, it may be another relative. There is going to be a lot of work, especially for an aging population, that is going to be focused on very few younger people. Everyone's going to have to take on this work for someone at some point if they're not already doing it. And it is real work. We need to tell the stories. I am so grateful that you're doing this podcast and getting these stories out, because that is how we learn about what is happening in our world, is by telling stories, hearing stories, seeing ourselves in stories, and then sharing those stories. That is how we become visible, and how we can learn for each other and lean on each other. We need community more than ever. And so anything we can do to find people who can help us along, the better off we'll be. from a very practical and logistical experience, we have to recognize caregiving as something that, needs to fit into our work days. And then in other ways, like maybe maybe healthcare needs to be more flexible. There aren't a lot of incentives right now for people like family doctors to open regular evening type appointments. We do them sometimes for urgent stuff, but we're still a very 9 to 5 kind of operation, and we expect other people to take time off work in order to come to see us. That's a very practical thing that could be done, but there has to be incentive for family doctors' offices to open outside the box of 9 to 5.
Dr. Laraya, you're going to be coming back on the heart of it all because there's so much to talk about.
I can't think of another specialty where the needs of caregivers is recognized and can be dealt with as immediately as it can be in family medicine. When I'm meeting with a caregiver who is also my patient, and I know where they've been and where they're going and what this means to their life, that completely changes the conversation that I'm able to have with them when we get together and maybe they're not with the person they're caring for, and we can sit down and I can say, "So, tell me, how's it going with your dad?" You know? And then that's when the tears start to flow and we get into the weeds about what's going on, because that relationship is already there and that trust is already there. So that's what I would love to see for everyone across the province.
I want you to be able to bill OHIP for this podcast appearance because you have done a service here. Thank you so much for being here. We will definitely have you. I can't wait to have you back on. I'm going to have a list of things to do. Thank you for everything you're doing and good luck with your mom and dad.
Oh, thank you so much. It's been such a pleasure to talk about this. It's been great. Got stuff off my chest too. This has been so therapeutic. It's wonderful to talk to you, Teri. So thanks for inviting me to be here today.
Thanks so much to Dr. Laraya. Oof, like Dr. Jabbar, I have found some gold there. I am sure she will be back on the podcast. And thanks so much to our presenting sponsor, CapitalDirect.ca. We are so grateful for their support and yours too. Please share this episode, so many helpful tips in there, and reach out wherever you find us. We are everywhere. What would you like to know from a family doctor about dealing with a senior in your life? Just fire us a note. Thanks to my co-producers, Carrie and Jess at 601 Digital, and thanks to you for listening. As always, please take care. I love that this week's recommendation is also a favorite of our guest, Dr. Laraya's. It is this season of The Pit. This medical series just walked away with a ton of awards for season 1, but virtually every episode this season could be an episode of this podcast. Noah Wiley is incredible, but the supporting cast are perfection also. A great reminder of all the things that doctors and nurses are managing on the regular.